This video is for radial nerve palsy, wrist drop video. The radial nerve comes from the posterior cord of the brachial plexus. Radial nerve injury usually results from acute trauma or compression of the radial nerve. Sometimes this condition is called Saturday night palsy. Sometimes alcohol is a factor as the person falls asleep with the back of their arm compressed by a chair back or bar edge. Sometimes it's called honeymoon palsy because one person is asleep on the other person's arm overnight, compressing the nerve. It's also called crutch palsy due to compression of the nerve in the axilla from walking with crutches. The radial nerve supplies the extensor muscles that allow the patient to extend the wrist and the fingers. It also supplies the triceps muscle that extend the elbow. If the muscles are not working, the patient will experience a condition called a wrist drop. Here there is an example of a patient with radial nerve palsy and wrist drop. The normal radial nerve function extends the wrist and extends the fingers. A radial nerve injury classically caused by fracture of the distal third of the humerus causes a wrist drop. The patient will also be unable to perform the hitchhike sign. If the nerve is compressed at the axilla, the triceps muscle will also be affected, and the patient will not be able to extend the elbow in addition to having a wrist drop. Here is an example of a patient that have a scar from repair of the humeral fracture. The patient had radial nerve palsy due to humeral fracture, and the patient has a wrist drop. Treatment, usually a brace or a cock-up splint. Physiotherapy to maintain muscle strength and avoid contractures. EMG and nerve studies. The brachioradialis is the first muscle to recover. The study can be done as early as 3 weeks after the injury, and we can follow the progress. Nerve exploration, repair, or graft. Nerve exploration is indicated in open humeral fracture with radial nerve palsy or in conditions that have had sufficient time without nerve recovery. Then you go ahead and explore that nerve, usually about 4 to 6 months. Tendon transfers, if the nerve cannot be repaired or its function cannot be restored. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.